minuto más mientras se unen más personas
Good
a la
morning,
sala.
everyone. One
Muchas
more
gracias por estar
minute.
con nosotros en
We're
este
we're
día.
waiting for more people joining.
Días, buenas tardes, buenas noches
Good morning, good
a todos
afternoon, good
y
evening
todas a
to
este webinar
everyone.
por el mes de
Welcome
la
to this
concientización del cáncer
webinar
infantil. Mi
on
nombre es Liliana
the
Vázquez, soy
Childhood
oficial técnico
Cancer
de cáncer
Awareness
infantil de la
Month.
Organización Panamericana de la Salud. Muy
I'm
contenta de poder
representing
estar con ustedes el día de hoy.
PAHO. I'm very
Good morning,
happy to be here
everyone.
with
Good
you.
afternoon. Vamos a tener
We're
interpretación en
going to
inglés,
have
español para
interpretation
los que
in
requieran,
English and Spanish
portugués.
and also
Y
Portuguese.
agradecidos de poder tenerlos el día de hoy
I'm very
también,
happy to
porque para
have
nosotros es
you
una fecha
all
muy
today.
importante
This is an
poder
important date for us
juntarnos y generar un espacio de
because we can
diálogo,
create
de
some
consenso también
a dialogue
y de
space,
información
a
nueva
consensus space
sobre los avances
with
que se
new
están dando en cáncer
input
infantil
on
a nivel de la
the
región de las
progress
Américas.
of
El mes de la concientización del cáncer
childhood
infantil
cancer.
es una fecha
And
muy importante
this
también
month is very
porque
important
conmemoramos la lucha
because
y el
this is
avance y
a
progresos
commemoration
de
of
muchos
the
niños,
fight,
niñas y
progress
adolescentes,
of
de
many
sus
children and
familias, de
adolescents, for
de
their
todos los profesionales de la
families,
salud
and
que
also the
trabajan con
health
niños con cáncer,
professionals
de todas
working
las
with
fundaciones, de la academia, de muchos
children with
involucrados en la atención de
cancer,
los pacientes.
and
Como sabemos, el
everyone who
cáncer
is
infantil
involved
es una de las primeras
in
causas de
this
mortalidad en
area.
los niños, niñas y adolescentes en el mundo. Solo en la
Cancer
región
is the first
estimamos son
cause
casi
of death
30.000
of many
niños, niñas y
children in
adolescentes
the
de 0 a 19
region.
años que van a padecer de cáncer y muchos de ellos
Many
van a
children will be
fallecer
suffering
por
from
causas que
cancer,
son
and many of
prevenibles,
them
causas que
will
tienen que ver
die.
con el diagnóstico
But
tardío,
because of
causas que tienen
cancer,
que ver
they
con el
need to
abandono del
live
tratamiento, con
with
el acceso a
this
medicamentos y
disease,
tecnologías, que es el tema
access.
central
There
del
are
día de hoy,
difficulties
y
with
con causas que tienen que ver con infecciones,
access
entre
to
otras,
medications,
relacionadas al soporte oncológico.
and they also die
Es
because
así
of the
que desde la
infections
OPS
they
y
get
desde
because
el
of
gran
this
apoyo que se
disease.
tiene
From
desde el
PAHO,
St. Jude Children's
we
Research
are
Hospital y de
supporting
muchos otros colaboradores, se viene trabajando
from
en el
the
marco del objetivo del cáncer
health
infantil
uh,
GACC
Center
desde el año
of
2018
Childhood Hospital
y el día de hoy
since we've
también
been
vamos a
working
revelar
since
muchos de
2018,
los
and
avances en el
today
marco de
we're going
esta
to
plataforma
reveal
global de
many
acceso
of
a
the
medicamentos
progress
oncológicos
we've
pediátricos
been working
de cáncer infantil, que es un
on
esfuerzo liderado por la
oncologic
Organización Mundial de la
or
Salud,
cancer
por el St. Jude Children's
medication,
Research
childhood
Hospital, en colaboración con UNICEF y
pediatrics,
la
and all the
OPS.
efforts
Así que
along
sin más,
with
le doy el
the
pase también a
with
mi co-moderadora de mi primer
WHO.
día,
Now I'll
la
pass the floor
Soad
to
Fuentes Alaví,
my friend
de Aparicio, de St.
Soad
Jude. Adelante,
Fuentes
Soad, para la
Alabi.
presentación.
Thank you, Soad, and I'll pass the floor to you.
Gracias, Liliana.
Thank you,
Y
Liliana.
bienvenidos a todos a
Welcome
este
everyone to
querido
this
y arduo
day
organización en conjunto con
and
OPS y St. Jude,
PAHO
eh,
organization
en conmemoración
and in
de
commemoration
Septiembre Dorado,
of
mes de concientización del cáncer infantil a
September,
todos.
Gold
Y
September.
mi nombre es Sol Fuentes Alaví, a todos
My
me
name is
conocen.
Soad Fuentes
Actualmente
Alabi.
solía
You know
trabajar con
me.
mi
I
querida
used
hermana
to work
Lili en
with
OPS, pero ahora estoy
uh,
trabajando en St. Jude
PAHO,
como
and I'm
directora
working
regional
in
para
St. Jude
México, Centroamérica y Caribe.
for
Y
Mexico,
pues
Central
vamos a
America,
dar
and the
paso
Caribbean.
al inicio de
And
esta
we're going to start
jornada.
with this
Y voy a empezar a
webinar.
hablar en inglés
And
porque
now
let
I'm
me
going to
introduce
speak in
to
English.
our Vice President of Regional Programs at St. Jude Children's Hospital and St. Jude Global Pediatric Medicine, Toby Casper, who has been working in public health and international development issues for more than 20 years, and now he's leading the implementation of the global platform for childhood cancer access to medicine. And he is also leading the work in global pediatric medicine with the implementation of the hubs in the different at global level in Dubai, Geneva, and Mexico. Toby, go ahead. Thank you and welcome.
Thank you, Saad and Liliana, and good morning, everyone. Apologies that I need to speak in English, but I'm glad that we have interpretation services. I will do my best to speak slowly, but of course, tell me if I'm going too fast. It's a pleasure to join everyone to celebrate Gold September. This is always a special time of year when we pause to reflect on the progress, but also the challenges around childhood cancer. This month is especially important because in just a few days' time will be the fourth high-level meeting on non-communicable diseases at the UN General Assembly here in New York City. This is a major moment, a moment for the global community to come together around the fight for non-communicable diseases. And I'm very excited to say that through the advocacy work of many people on this call and many others, we now have included language in the draft outcome declaration for the fourth high-level meeting that echoes the GICC language around a 60% survival rate as a global target. That's an exciting development that we hope to have ratified at the international level this week. And it just means it's all that much more exciting to be here with all of you today. As Saad mentioned, I've been working in global health for more than 25 years. And one of the first issues I started working on was, in fact, access to medicine. That was originally in the context of HIV/AIDS, where there were actually a lot of similarities to some of the challenges we're grappling with in pediatric oncology. And one of the things that have learned over the past 25 years of working on this issue is the importance of partnerships. Access to medicine is a very complicated issue, and it can never be dealt with by just one actor. It's not something that ministries of health can address alone. It's not something the pharmaceutical industry can address alone. It's not something that civil society or medical institutions can address on their own. We've the only success stories globally around improving access to medicine come when all of those partners, plus others, such as regulators and advocates, all come together and are all pulling in the same direction. One of the reasons that I'm really excited to be here this morning is that I'm sharing the stage with a distinguished set of panelists and also good friends, people whose work I've come to appreciate over the year plus that I've been working at St. Jude, and even the longer time that I've been working on the global platform for access to childhood cancer medicines. And one of the things that we'll see over the next hour or so is wonderful examples of collaboration that bring together different stakeholders. I've had the pleasure of visiting Ecuador several times in the context of the work on the global platform. And it's going to be such a pleasure to listen to Lizette talk about the amazing progress that has happened there. Of course, it has not always been easy. Like with any major challenge, there are always bumps in the road. But the spirit with which they have approached things in Ecuador is truly commendable and is enabling us to make rapid progress. I haven't yet had the pleasure of visiting El Salvador, but I look forward to doing so. And I've heard wonderful things about the work that's underway there that we'll get into to more detail about in a second. And then later in the presentation, we'll hear about NCCB Akaya, which is an initiative at St. Jude that also has the effect of bringing together stakeholders from different parts of the pediatric oncology community, from governments to medical institutions, in a way that has been very successful at uniting those stakeholders and steering them in a common direction. And then last but not least, it was my pleasure recently to be in Temuco, Chile for the recent PINDA workshop, which was a wonderful example of how a national community can come together to address pediatric oncology. And I know that Julia will tell you more about that, but it's a fantastic example of how a combination of government leadership and a well-organized pediatric oncology community can work together to do incredible things to improve survival rates in that country. So I think we've got a very rich hour and a half in front of us, and it's really just my pleasure to kick this off and to be here with all of you today. Let me pass it back now to Liliana.
Thank you so much, Toby. I will switch to Spanish now. Muchas gracias por las
Thank you very much for your words, for the introduction, for the work you're doing in St. Jude and the collaboration you're mentioning that is so important for the world. Today, we're going to focus on those countries with big progresses, which will be important for all the region. We have all Latin American colleagues here from the Caribbean, and they are going to follow all these steps to improve care for the children with cancer. I like to acknowledge that this trust we have in all these countries, and Latin America has brothers, sisters, and we can work in a harmonious manner. Thank you for your words, and I'm going to pass the floor to Santiago Milan, our technical lead of the global platform for access to medicines for childhood cancer. Go ahead,
Muchas
Santiago.
gracias, Liliana,
Thank
Soad,
you, Liliana,
y
Soad,
buenos
and
días a
Tony.
todos y a todas.
Thank you
Saludos
very much
cordiales
to
desde Ginebra.
everyone. Greetings
Es un
from
honor para mí darles la
Geneva.
bienvenida a
I'm
este
honored to
webinar en el marco del mes de la
welcome you
concientización del
to
cáncer
this
infantil. Cada
month,
septiembre, el lazo
the
dorado nos
Childhood
recuerda
Cancer
el
Awareness
compromiso
Month.
global que compartimos, que es garantizar que ningún niño,
We
niña
want
o
to
adolescente
ensure
con
that
cáncer pueda quedarse.
no
En la región de las
children or
Américas y también en todo
adolescents
el mundo,
uh,
este símbolo se
suffers from
convierte en una
cancer
poderosa llamada de
and
atención
feel
para
alone.
visibilizar los
We want
avances,
to
reconocer
make
los
visible
desafíos
the
pendientes
progress,
y
dependent
fortalecer la cooperación
challenges,
entre
and
países,
strengthen the
instituciones
cooperation
y
in
aliados
countries,
estratégicos.
institutions,
Este
and
año, además, como acaba de
strategic
mencionar Toby,
partners.
coincide con la
As
cuarta
Toby
reunión de alto
mentioned,
nivel de la Asamblea
we
General de las
had
Naciones Unidas
the
sobre
fourth
la prevención y el control de las
meeting
enfermedades no
from the United
transmisibles que se
Nations
está desarrollando
on
en Nueva York, por lo que este
transmissible
año será
diseases in New
doblemente
York,
especial.
and this year is
Se
going
espera que
to
esta
be
semana se adopte una declaración política que,
special.
entre otros aspectos
We
claves,
hope that
llame
among
a la aceleración
other
de esfuerzos para
key
cumplir el
aspects,
objetivo
we
de la
can
Iniciativa
call
Global para el
the
Cáncer
collaboration
Infantil
for
para
global
aumentar la tasa de
initiatives and
supervivencia de los
to
niños con cáncer a
increase
nivel
the
mundial
rate
a al menos un
of
60% para el año
treatment in
2030.
children at least in
Hoy nos reunimos para
50%
destacar
to
un aspecto
2030.
fundamental en
We
esta
are
tarea,
all together
el acceso
today
equitativo a
to
medicamentos y tecnologías
talk
de
about
calidad.
access
Sabemos que el
and
diagnóstico
medication
temprano,
for
el tratamiento
a
oportuno y
quality
los
health.
cuidados integrales son
We
pilares esenciales
understand
para
that
asegurar la supervivencia y
comprehensive
la calidad
care
de la
and
salud
other
vital de los
matters are
niños con
going to
cáncer.
improve the
Pero también
life
sabemos que
quality
sin
of children.
acceso
And we also
a los
know that
insumos
without
adecuados, estos
access
pilares se
to
debilitan.
adequate
Y esta no es una
input,
tarea
all these
sencilla debido a
pillars
los
will
problemas de
weaken.
acceso,
And
costo
this is
y
because
y
of
calidad en
cost,
el mercado de medicinas contra el cáncer
quality in
infantil.
the
Muchos de nosotros lo
medications
sabemos.
markets, and we all know
Desde la
that.
Organización Mundial de la Salud, en estrecha
From
colaboración con SANYUD, la
WHO and in
Organización
collaboration with
Panamericana de la Salud
St.
y los
Jude,
Estados miembros, hemos
PAHO,
impulsado desde
and member
2021 la
states,
Plataforma
we
Global de
have
Acceso a Medicamentos contra el
boost
Cáncer
the
Infantil
global
como parte de la
platform
Iniciativa
for
Global para el
access to
Cáncer
medicines for
Infantil.
childhood
El
cancer.
objetivo de la Plataforma
The
Global
aim of
es
this global
proporcionar el
platform
suministro de
is to
medicamentos de
provide
calidad garantizada contra el cáncer
quality
infantil
medications
a los países de
for
ingresos bajos y
a
medianos, dando un
childhood
apoyo integral
cancer to different
esperándose
countries,
alcanzar 120.000
supporting them
niñas en todo el
and
mundo a principios de este
reaching
año. Esta plataforma
120,000
presenta,
children
pues,
in the
una
following
herramienta
years. This
completa para
platform
mejorar el
is a
mercado, reducir
comprehensive
las brechas
tool
y avanzar hacia
to
sistemas de salud más
close
justos y
gaps
resilientes.
so
Para ello,
children and
trabajamos con
adolescents
Estados miembros y fuentes
access
estratégicos de
to
manera
quality
multisectorial
medication and
en
treatment.
áreas como la
We've been
cuantificación
working
de la
in different
demanda, la
sectors,
cadena de
uh,
suministro,
supply
aspectos
chain,
clínicos, la regulación de
clinical
medicamentos,
aspects,
la voz de
medication
marca
regulations,
y el monitoreo y
governance,
la evaluación. Hoy en
monitoring,
día, la
and
plataforma
assessment.
global está siendo implementada en 12
Nowadays,
países
this
en todo el
global
mundo,
platform has been
varios de los cuales
implemented
empezaron a
in many
recibir
countries in the
medicamentos desde
world,
hace unos
and
meses.
we're receiving all
Durante
these
esta sesión
medications
tendremos oportunidad
in
de conocer
different
experiencias exitosas de Ecuador y El
countries.
Salvador
In
como
these
países
sessions, we're going
participantes
to
de la
listen
Plataforma Global de
to the
América
different
y
countries
asimismo de
on
Chile,
their
República
examples and
Dominicana y la Región de la
experiences, Chile,
Planificación Nacional
Dominican
para el Control del Cáncer
Republic,
Integrado a
and
Niños,
other countries
Adolescentes y Jóvenes Adultos.
on the different
Estos
practices
países están
there.
liderando
All
esfuerzos
these
para mejorar el
countries
cáncer
are leading
infantil, el acceso
efforts
a
to
medicamentos y
improve
tecnologías,
childhood
y su experiencia
cancer
asegura que lo
development
consigan y nos
technologies, and
muestran que
their
el cambio es
efforts
posible cuando hay
inspire
voluntad
us
política,
and
colaboración
makes us
técnica
believe that
y
change is
compromiso humano.
possible
Quiero
with
agradecer
human
profundamente a
commitment.
todas las personas que hacen posible
Thank
este
you
evento,
to
a
all the
nuestras
people who
moderadoras, los
made this
panelistas, los
event
técnicos
possible, our
y, por
panelists,
supuesto,
the
cada uno de
technical
ustedes por su
teams, and my
información.
colleagues, and all of you who
Les
are
invito a
here
aprovechar este
today.
espacio
I
para
invite you
aprender,
to
para
take
compartir,
advantage of
para
this space
fortalecer
to
nuestras
share,
redes.
strengthen
Su
our
participación es clave
networks.
para seguir
Your
construyendo una
participation
región y
is
un mundo
key to
donde el cáncer
continue
infantil no sea
building
una
in this
sentencia,
region So these matters are not an issue in the future, and with a lot of collaboration, solidarity, we will achieve that. Thank you very much, and I hope this webinar is a successful webinar. And I pass the floor now to my colleague.
Muchas gracias, Toby y Santiago, por sus palabras.
Thank you, Toby and Santiago, for your words.
Y por enmarcar la importancia
for giving us the background on the importance
de este gran trabajo que se
of
está
this big
haciendo en la
work that
plataforma global para el
we've been
acceso a
doing in
medicamentos
the
contra el
global
cáncer.
platform for access to medicines for childhood cancer.
Para mí un placer dar
It's a
paso a la
pleasure
siguiente
to
presentadora, quien
pass the floor
guiará
to
en
our
los
following
siguientes segmentos sobre los
panelists.
avances regionales
She'll be
en la
talking about
implementación
the
de
regional progress in
plataforma global para
implementing
acceso a
the global
medicamentos.
platform
Nuestra
for
querida
access to
doctora
childhood
Liliana
cancer
Vázquez,
medicines.
quien desempeña
Dr.
un
Liliana
rol
Vázquez,
en la Organización Panamericana de la Salud,
she is the
donde ha
technical officer for
un rol
childhood
central en
cancer,
el impulso de estrategias
PAHO,
para el control del cáncer infantil
WHO.
en toda la región. Su liderazgo
She's been
ha
working in
sido
the whole
pues
region. Her
fundamental para fortalecer los
lead has
sistemas de
been
salud,
fundamental to
coordinación
strengthen
y
all these
colaboración
areas
y apoyar la implementación
and in
de
collaboration
indicadores que
of all
incluyan el acceso a
this
medicamentos esenciales para
implementation,
y adolescentes con cáncer, pero también impulsando
not only for
desde hace muchos años
children
pues la
and
implementación
adolescents with cancer, but also the implementation of
adelante.
this regional program.
Muchas gracias, Soad. Y
Please go
bueno,
ahead. Thank you,
realmente este
Soa.
es un espacio súper importante
This
también,
is an
porque
important
es una de las
space
primeras
because
veces
this
que
is the, I
tenemos a
think, more or
continuación
less
de
the
esta
first time
presentación
that we
la
have
posibilidad de
this
escuchar de los mismos
presentation and we
protagonistas de los
can
mismos
listen
países
from
y
the
que también, como
protagonists
decía
of the
Santiago,
different
también
countries, as
gracias por tus
Santiago was
palabras.
mentioning. Thank you for your
Entre
words.
los países que están implementando esta
All the
plataforma
countries
global,
implementing this global
yo voy a
platform,
dar solo un panorama
I'll give
como
you
general de lo
a
que
general
se está avanzando, de los desafíos
background or
también, de
summary
cómo es
of
que
our
también podemos sacar
challenges,
algunas
of what
oportunidades
we've been
importantes
doing, what
de estas
opportunities we
experiencias a
have
nivel
on all
regional.
these experiences at a regional
Primero,
level.
como un poco
First of
de
all,
contexto en que definitivamente
context.
estamos ante un desafío regional. Creo que todos los que
This is a
participamos en
regional
este webinar
challenge, and the ones
tenemos
who participate in this
un rol
webinar
en el tema
know
de
that we
medicamentos. Yo creo que por eso
have
es que
a
estamos aquí
role
justamente
on
porque el tema
medication.
de medicamentos y
And we're
acceso a
here
tecnologías nos
because
toca de
the
cerca, ya
access to
sea como
technology
profesional de
and
la salud
medications
o
as
como
health
fundación o
professionals
como
or a
incluso parte de la
foundation
comunidad
or
de
part of
cáncer
the
infantil.
community.
El tema del
There is a
acceso
big
y la
challenge
disponibilidad a los
in
medicamentos
childhood
oncológicos
cancer.
esenciales
Access to
pediátricos es relevante y como
oncological
sabemos impacta
medications is
directamente
impacting
en el pronóstico de los niños. Este
prognosis
es
of
un
children.
mapa que muestra
This
algunos
is a map
resultados
showing
que
results.
fueron recogidos desde un estudio
And we
realizado
collected
desde
this
la
data
Sociedad
from a
Latinoamericana de
study
Oncología
from
Pediátrica
the
y la
Latin
OMS,
American
junto
Society
con
and
múltiples
PAHO, along
colaboradores
with different
la iniciativa de cáncer
collaborators
infantil, puntos
on
focales de
childhood
cáncer infantil
initiatives,
de 20
focal
países de la
points
región
from
para poder
20
levantar
countries in
información
the
sobre la
region so we could
disponibilidad de
collect
medicamentos. 35
information on
medicamentos
medications
oncológicos pediátricos. Y
availability,
vemos que
35
realmente estamos ante
medications,
un panorama
medicines.
equitativo.
We
Mientras
are
más oscuro
against
sea el color, significa que hay
equitable
un reporte desde
availability of
la
childhood cancer
perspectiva
medicines.
del
You can see
proveedor de
that
la
there is a
salud,
perspective
del profesional de la
from
salud que atiende a estos niños y
health
que está
professionals
directamente
seeing these
relacionado
children who
con
are
el
directly
tema de
related
medicamentos.
to
Y mientras más
medications.
claro, se refiere que hay una
And
menor
the lighter
disponibilidad en
areas means
general de
that
forma
there is a general
sistematizada de
availability
los
in a
medicamentos oncológicos
systematized manner
pediátricos.
of
Entonces
all
estamos
these
ante un desafío
pediatric and
importante.
oncological medications. It's
Estas diferencias
important to
tampoco no
understand
tienen
these
que ver
differences.
exclusivamente con el
This doesn't
ingreso de
have
un
to
país,
do
sino
with
también tiene que ver
the
con
access
factores
to countries,
múltiples
but to
de temas
multiple
de
factors
adquisición, de temas
that
de
have to do
regulación de
with
medicamentos.
acquisition,
Entonces, eso es
medications
algo que
regulations,
es
and
muy
this is
importante
something
conocer para
we
saber
need to
hacia dónde
understand
tenemos que
so we
apuntar.
know what
Igualmente,
our
en este
aim
mismo
is.
estudio
In this
realizado a finales de
same study we
2024 y que para
performed at the
nosotros
end of
constituye un
2024, and
basal
for
de
us
información que nos
is
puede servir también
a
para poder
thermometer
monitorizar
or
algunos de los
measuring
avances. Vemos
thermometer
que hay
to understand
medicamentos
our
dentro de estos
progress. We
35
understand that
medicamentos
from all
oncológicos
these
pediátricos
medicines,
esenciales que van a tener mayor
essential pediatric
posibilidad de
oncology
disponibilidad. Estar
medicines that will be
disponibles en un
more
país,
available
en un
in some
centro de salud,
countries,
en un
in
hospital
a
que atiende a estos
health
niños con cáncer,
center
como
or a
hay
hospital,
medicamentos como
as well
plata,
as
Sardinic,
other
tresivacenco,
medications
que van a ser mucho
which
menos
will be be less accessible to health professionals so they can treat children with cancer. And this has to do with many factors regarding the available suppliers and the possibility of having technologies and the inclusion of medications that are basic for different countries. As we all know, this year we have updated the essential pediatric oncology medicines for adults, for children, and with that, we have this challenge for the following years, and we need to add more and more medications or medicines. Another important topic is that apart from having all these medications available, we need to understand that quality is important. There have been reports on quality issues, whether clinical or visible matters in patients or the high toxicity of medicines, higher than what is considered in in the usual parameters. Every two professionals, at least one, reported quality issues on the use of these medicines. This is not a novelty. We know that there are reports from other medications in the same regard, but we will be listening a little bit more on the experiences of these two countries, starting with the platform implementation, that it is likely that having quality medicines that are certified is crucial for children to be cured. And it's worthy to continue working on this because these children need these medicines. That's why this global platform for access to medicines for childhood cancer, it's important so we can supply all these oncological medicines so we can support countries not only in a financial manner, but logistically in the technical areas, so all countries are strengthened and they can progress more with high standards. It is important to mention the pillars, work pillars, access, quality, and reasonable cost so they can purchase or get, apologies, these medicines. And that was our strategy. And this strategy is not only for the purchase management, but also technical and support mechanisms to supply and to quantify and plan demand. On all that has to do with strengthening cold chain, there is a tool we call QuantMed that helps us with supporting countries so they can estimate the demand of medicines, high quality pediatric oncology drugs. Some other comments of other countries implementing this platform. In a couple of years, we've been working and following up the work done in Ecuador, as Toby mentioned, with a lot of expertise, technical cooperation, and the collaboration of multiple actors. The work with the foundations, civil society, researchers, and this is important to progress in a common goal so we can reach children so they have quality treatment. I consider that these progress are very important in a systemic manner. I think there has been a past and a before and an after situations. And I know my colleagues will be explaining this better. How a country such as Ecuador with no visibility of cancer, and it was an issue, a public health issue, and they have progressed a lot in these matters by having commissions and and the a governance with a governance organization so they can work on these matters with clinical management so they can sit with all their colleagues and say these are the treatment protocols we will be following up, we will be following in the future, and having a consensus on this is very important for children's treatment, including these oncological pediatric treatments that didn't exist there, and so they could progress in medicine supply, equipment, personnel. All this progress is so important. And then this after situation, how everything there was strengthened, and this is pretty relevant. It's important to mention in the case of Salvador, with a lot of strength, and we worked a lot on the on childhood matters with products that are necessary, and they also have the challenge now, the challenge of implementing this global platform in the whole country. We have some pictures here on the work we did the past months in El Salvador, so we could start with the work of the platform. And they are really proud of all the progress they achieved, this subcommission of childhood cancer, so they can continue working on this. The hospitals that will be part of this platform, and the status diagnosis, purchase management, cold chain, how they could strengthen all in the whole nation, and also legal documents which are important to progress. Regional figures or regional numbers. It's been an important investment. Up to now, investment of 2.2 million in medicines purchased and delivered, so we can have the availability for children with cancer, more than 23 types of medicines, more than 25,000 units that were delivered in the whole country. In the pilot country, Ecuador, for pediatric cancer, including 100% of essential medicines, more than 1,000 patients estimated to benefit in 2025. And in terms of resources from the different countries, such as Ecuador and in El Salvador, and the different regions for educational modules, one regional virtual course, QuantMed tool. And maybe some of you have followed this course for education modules, as I mentioned before, and specific training in pediatric oncology and other educational modules for basic recommendations of administration and oncological pediatrics matters available at a regional level. All that is available nowadays, and let me put the link in the chat box so you can see it. And I also wanted to mention that there are opportunities for countries which are not part of this platform. In the future, there will be an opportunity of participating. The strategic fund of PAHO has the fund for the purchase of cancer medicines. It's important to mention this because in this webinar, colleagues from other countries are participating, and they would like to access to these medicines at an adequate price with quality and access. With this global platform we have received, there has been more hospital countries that nowadays are benefiting from these medicines, and this is a fundamental thing. And from the different countries, we can see all day through communication and the PAHO offices in the different countries, we could continue progressing. And and implementing. That's what I wanted to comment. Thank you very much to the two other panelists with who will be presenting, Dr. Lisette Matmore, who is going to present now. She is the focal point of childhood cancer in Ecuador, and she will be presenting on the different progress in that country. Thank you.
Un honor poder estar aquí con ustedes, sobre todo porque esto evidencia el compromiso que tenemos desde nuestros
It's a
diferentes
pleasure to
puntos
be
de
with you. This
localización
acknowledges
en
the
el mundo.
different points of view that
El
we have from the
objetivo
different
común
location
que
points in the
existe,
world.
¿no?
The common
Cambiar la
objective that we
realidad
have
actual
in
para
our friends
niños,
of being
niñas y
able to
adolescentes en
change the current
cáncer.
reality
Entonces, antes que
for
nada, voy a
children
avisarles que la siguiente
and
diapositiva
teenagers
viene
with
con
cancer. I will let you
imágenes
know that the
que todos hemos
next
visto,
slide shows
pero
images that we've all been able to see, but
quizás no parte
it is
de las
maybe not a part
presentaciones
of the presentations
referentes a
in
temas
reference to
oncológicos reales.
pediatric
Estos son los niños a
cancer
los que queremos impactar, a los que queremos
parts.
llegar
These are the children
y
that we want
las
to get to, that we want
realidades
to
que
impact
queremos
on,
cambiar.
and the realities that we
Y sin más, continuamos con la siguiente diapositiva, por favor. Al
will
igual
be
que varios
continuing with the following
países de la
slide. Now, the
región,
same as other countries in the
aunque
region,
tenemos grandes
although we have
estrategias,
very good
tenemos realidades
strategies,
demasiado
we have
dispares. Entonces, en
different
cuanto al progreso acorde
realities.
a
So,
la,
in
a los
reference to
estudios
Ecuador,
publicados
according
por
to
la
the
OMS
profile
en el
published by the
2021,
WHO in 2021,
presentamos estos números,
we are
¿no? Estos
presenting
pueden
these
ser,
numbers here.
pueden
This,
ser todos los
you can have
demás.
access to
Lo
this
único que no
freely.
van a encontrar
The only
similar
thing that you're
es
not
este
going to find similar
1074.
is this
En la publicación
1074.
original
In
se
the
habla de
original
1027 casos nuevos de
publication, we
cáncer
have
infantoadolescente en el
1,074
país,
new cases of
con corte al
this kind of cancer in the
2022. Por
country.
el
With the cut of
Bogotá hablamos de
2022,
1074
we're
casos.
talking of
Entonces, nuestra
1,074
realidad en
cases. So
este
our
momento era
reality at this
que, bueno,
moment
y
was
continúa
that,
siendo de cierto
and it
modo,
continues being
incluso
in a
hablar de
certain way,
supervivencia
that even to
global,
talk
solo
about
tenemos
global
números
survival,
para
we only
leucemia
have
linfoblástica
numbers
aguda y en un
for
rango de
this
edad del
acute
50 al
part, and this goes
59%.
from
Y
59%,
es
50 to
necesario preguntarse en este
59%.
momento
And
si
it's
dónde está el
important to
resto de
mention
diagnósticos
where are the
oncológicos.
rest of oncological diagnoses.
Conocer la realidad de cada país
To know
permite
the
saber
reality of each
dónde
country
están las
allows
áreas
us
de
to be able to
oportunidad
see
para
where we
poderlo
have the
cambiar.
areas of opportunity to be able to change
Entonces,
this.
pudimos
So
identificar a través de
we
un
were able to
análisis
identify through
situacional que
a
se
situational
hizo con
analysis that was
apoyo
done
de
with the
OPS
support
Nacional y
of
OMS
PAHO and WHO.
como rama mundial, ¿no? ¿Cuál era la situación
We were able to see what was the
real
situation, the
de
real situation
el apoyo y la
of
visibilidad política que puede
the
existir para
support and
mejorar
the
y
political
cambiar
visibility that there could
la
be to
realidad
be
de
able
estos
to
casos?
improve
Y
the
encontramos que
reality of
había
this
apenas un
children. And we found that there was
82%
only
de medicamentos
82%
esenciales
of essential
incluidos en el cuadro
medication
básico
included in the
que eran
basic
destinados al
chart.
tratamiento
And that all these were
oncológico
designated
específicos en
for
esta población.
specific
Hablamos de
oncological cares in
7
this
centros que en
population.
ese
We
momento
are
habían
talking about
sido
7 centers that
identificados
at that time had
como
been
los que daban
identified
atención
as the
especializada
ones
en
that give
cáncer. Y
specialized
encontramos una
attention in
fortaleza
cancer.
que
And we found
debería
a
ser
strength which should be
actualizada, cabe el término,
landed
para esta población
for
específica.
this specific
Tenemos un programa
population. We
específico
have
y
a
una
specific
directriz
program
fuerte
and a
para
strong directive
los sistemas de
in for
referencia,
the
¿no?
reference
Sin
systems.
embargo, no es específico
However,
para
it's
casos
not
oncológicos.
specific for oncological
Y
cases.
esta detención
And
o esta demora
this
entre la captación
delay
del chico
between the
hasta que pueda ser
collection of
orientado
the child so they can be
a
oriented
un abordaje que permite establecer su
into an
diagnóstico
approach that allows them
temprano
to
e
be able to
iniciar su
establish an early
tratamiento en el menor
diagnosis and
tiempo
to be able
posible,
to
se convierte en
begin
una
treatment as soon as
debilidad
possible
que se
becomes
traduce
a
a 40
weakness
chicos que
that is
fallecen de cada
translated to
100 son
40
diagnosticados dentro
it's
del mes.
children
Siguiente
that
diapositiva.
pass away from the diagnosis. Next slide, please.
O yo le puedo dar, yo creo que le puedo dar, a ver. No, no
Yeah,
le puedo
hold
dar.
on. Yeah, sorry, I
Como
can't
la
do it. You have to do it for
plataforma
me. And this is
mundial
how
para el
the
acceso a
world's
medicamentos para el
platform
cáncer
for the
infantil
access to
se
medication for
vuelve
child
el
cancer
catalizador para poder
becomes the
utilizar todos
catalyzer
los
to be able
recursos que
to use all of
tenemos,
the
tanto
resources
normativos
that we
como
have, both on a
logísticos,
standard and also
y
logistic
buscar la
ones,
forma de
and to be
mejorarlos.
able to try the
Y esto
best
nos
way
abrió
to improve
diferentes
these.
frentes,
And this gives us
diferentes
different
aristas,
fronts,
porque no es
different points,
solamente
because
recetar
it's not only
medicamentos,
to be
sino
able to receive
alinearnos al
medication,
objetivo
but
del
it's about
objetivo
aligning this to the
global, ¿no?
objective of the global
Que es
strategy.
elevar la
And
supervivencia
it's
al
about
menos hasta el
elevating the survival at
60% para el
least to
2030.
60% for the year
Y
2030.
este
And
final
this
no es
objective, this final
únicamente
objective
tener
was
los
not
fármacos,
only about having
sino
medication,
garantizar que
but
sean
it's about
administrados de la
guaranteeing
mejor
that they
manera
are administrated in the best way
posible
possible
al
to
paciente,
the
al
child, to
adolescente,
the
al niño,
patient, to the teenager.
protegiendo también a todos
And
aquellos que interactúan de
it's also
manera
about
directa o
protecting those that
indirecta
interact in a direct or indirect
con
manner
este tipo de
with
medicamentos.
this type of medication.
Siguiente, por favor.
Next one, please.
Y bueno, esta diapositiva es
And this
prestada
slide
obviamente
is
de todo
was
lo que es la
lent to me
estrategia de la
in
plataforma que
reference to the
usted
whole
ya ha
strategy of the
visto.
platform, and many
Formamos
of you have
parte
seen
del
it.
Ecuador como
We
uno
as
de los 6
Ecuador form
países de
part
la
of one of the
primera
6
cohorte que se
countries of
beneficia
the
de
first cohort that is
este proyecto de
benefited
la
from this
GPA-CCM.
project of
Y
GPA-CCM.
solamente para mantenerlo
And only
presente,
to
hablamos
maintain
de
this in
425.000
consideration,
casos
we
que
are
se
talking about
diagnostican en el
425,000
mundo.
cases that are
Y el
diagnosed in the
80% de
world,
estos están
and
dentro
80% of
de
them
países de
are
características
inside
como el nuestro,
countries that have
medianos y bajos
similar
income.
characteristics to
Se habla
ours,
de casi 100.000
low
muertes
to
en este
medium
tipo
income. We're talking almost
de
about
esta población
100,000
que está
deaths in this
localizada
population
en
that
estos
is
países
located
precisamente
in these countries
porque
due to the
porque no
fact
tenemos acceso a
that we
medicamentos,
don't
porque
have
el
any access
tratamiento
to
quizás no es tan
medication
accesible,
because the
porque la
treatment
atención
maybe
en
is not as accessible
primaria de salud
because the
quizás no es
attention,
tan
the primary
fuerte,
health
que
attention
tenemos retrasos
is
en las
not as
predicciones
strong because we
y
have
así es que
delays
este
in this.
programa
And
nos
that
permite
is why this
capitalizar
program
justo
allows us
esta
to be able to
responsabilidad.
catalyze
Siguiente,
and
por favor.
use natural resources.
Hay algo que no la
There is
retroceda.
something,
Hay algo
do not go back,
que
please.
de
There is
pronto en la
something that
diapositiva no lo
maybe
dice.
in the slide I
El
did not mention,
80% de estos
but
chicos puede
80% of
curarse en
these
casos,
patients can be cured in
que deben preocuparnos. Si estos
cases
chicos
that
nacen
should
en
be of
países
our
altos
consideration.
tienen una
If they
posibilidad
are born in
de
countries of high
80%
income,
de
they have a
tener una tasa de
possibility
curación.
of over
En
80% of
países
being
de
healed.
características
In
como el nuestro,
countries
estamos
with our
hablando de un rango
characteristics,
que va entre
we're
20 y
talking about a range that
40%.
goes between 20
Y
and
otra vez
40% of
estamos haciendo la
survival.
pregunta de los
And here
rangos.
we're in the
¿Por
same
qué?
end
Si estamos
again.
en el mismo
Why?
mundo,
If we are in
somos
the
personas
same
que
worlds, if we
estudiamos,
are
tenemos
people that
normas que
study,
nos
we are
rigen
people that have
y tenemos la
standards,
capacidad
and we have the same
demostrada de
capacity
hacerlo.
to do
Y
things
así
better
es como
every
en
time.
Ecuador,
And that is
la
how within
primera
Ecuador,
fotografía
we have the
podemos ver
first
al grupo
photograph and we were
inicial.
able to see the
Muchos ya no
initial group.
están, otros han
Many
sido
of them are no
reemplazados,
longer here.
otros
Some of them
fueron
have been
reemplazados en
replaced.
su
Others
momento,
will be replaced, of course,
pero
at a
el
given moment in time.
compromiso
But
y
the
el
commitment
enamoramiento que
and
tenemos con esta
what we
estrategia
have here with
nos
this
permite continuar en la
strategy
misma línea de
allows us
trabajo.
to be able
Y
to
hemos
continue
tenido
in the
3 ejes,
same
el de
work line.
gobernanza, el de
And
gestión
we've had
clínica y
three
el de
accesses
industria
in
y cadena de
reference to
suministro. En la
management and
otra foto
supply chain and
establece el
clinical
consultor
management. And
nacional
here
de
we also
enfermedades
have
no
the National
transmisibles,
Consultant of Non-Communicable
como
Illnesses,
empezamos y
which is
todavía
who we
continuamos
begun
ahora
with,
con un
and
apoyo
we
más,
still
que es la doctora
continue
Carmen Guerrero.
right now with the support
Siguiente,
of
por
Dr.
favor.
Carmen Guerrero. Next slide, please.
Y no puedes empezar, no puedes
And you
continuar,
cannot
no puedes
begin, you cannot
identificar ningún
continue,
tipo
you
de área de
cannot
oportunidad si no tienes un
identify any
mecanismo de
area of
gobernanza
opportunity if you do not have a
definido.
governance
Así
mechanism
nace
that
la
has been
Comisión
defined.
Nacional de Cáncer
And
y
that is how we
DNA,
have the Commission,
hecha
National
por el
Commission of
Consejo
Cancer,
Nacional de Salud,
uh,
que
supported by the
tiene
National
una
Health Council, which has
articulación
an
intersectorial, tanto de red
articulation
pública como red
of
complementaria, como entidades
public
público-privadas,
network,
y
complementary
que
network, private
también cuenta con
network
la
as well. And it also
participación,
has
aunque
the
no tienen voto,
participation, although they do
de
not have a vote,
representantes de
of
OPS Nacional
representatives of a
y
national
de OMS, y
PAHO
obviamente
and
garantizados con
also
la OMS
linked
Nacional.
to the
Entonces, esta
regional
Comisión
WHO.
Nacional
So
nace
this
en
national
julio del
committee is
2024,
beginning
forma
in
parte
July
y está
2024,
encabezada por el
and
Ministerio
it
de
is
Salud Pública, el
formed
Instituto
and led
Nacional
by
de
the Ministry
Seguridad
of Public
Social,
Health,
la
the
Policía
Equatorian
Nacional, las
Institute
Fuerzas
of Social
Armadas,
Security,
la
National
Sociedad
Police,
Médica
Armed
contra el
Forces,
Cáncer,
the
la
Society
Federación
of Light
Peruana de
Against
Propiedad
Fighting Against
Privada de
Cancer,
Vías, el Ministerio de Inclusión
the
Económica y
Ministry of
Social, la
Economic and Social
Academia con
Inclusion, the
universidades
Academy with
y la
universities,
representación de
and the
toda la sociedad
representation of the
civil,
whole
casi
civil
40
society,
fundaciones en dos
which is almost 40
representantes.
foundations represented.
Siguiente diapositiva, por
Next one,
favor.
please.
Y sin detenernos demasiado,
And without
todo el
stopping there
trabajo que
much, the
se ha venido
whole
dando
work that has been
desde julio
delivered
del
since
2024
July
hasta mayo del
2024
2025,
until May
desde la conformación de
2025,
la comisión,
from where
a
the
través de
commission
la
was
cual
first
tuvimos mayor
formed,
fuerza para
through
incluir
which we had
3
more
medicamentos que no
strength to be
teníamos
able to include
dentro
3
de nuestro
medications that we
cuadro
did not
nacional
have
básico
within our
de
basic
medicamentos, ¿no? La Pegaspa, la penicilina
national
arsenic, la
parts in
artemisinin.
reference
La
to
restricción de
the different different reception of medications that at the end of the day was able to be done in February. 18 this year. And finally, the socialization of therapeutic schemes that are consensuated and in reference to being able to see this national protocol, but it forms part of the first step for what would be done for 2026, the beginning of the work for national therapeutical protocols. And within this part, since May until now, we're actually saying that we have been able to obtain logistic, financial, and technical support to be able to reinforce hospitals that are benefited from this medication with the acquisition of different ends, the equipment for cold chain, and the support to be able to put the course of national recommendations for different kinds of management that are important resources when training the staff natural resource that we have in the country.
Y dentro de nuestros pilares de trabajo, inevitable
Within our
mencionar
work pillars, it is
que
important to
en
mention
este
that
momento la Comisión Nacional se
currently
encuentra trabajando
the National
arduamente
Commission is working
para
to be able
organizar
to
los
organize
protocolos
what the
terapéuticos
therapeutic
del
protocols
aislamiento
are going to
elástico en el
be
2026.
in the year
Asimismo, desde el
2026.
Ministerio de Salud
And also from
Pública
the Ministry of Public
estamos
Health,
elaborando los
we are
convenios
preparing the
para integrar a
agreements
los hospitales de la fase
to
2, que son
integrate
4 núcleos
phase two
centros,
hospitals,
Guayaquil,
which are
Quito,
for nucleus
Honduras
Guayaquil, Quito,
y Puerto
Cuenca,
Viejo.
and Puerto
Estamos
Viejo.
ya con una
We are
propuesta
currently
para la
with a
notificación
proposal for the
formularia de
notification for the
notificación
form
obligatoria en
of
cáncer en
notification as
NNA,
mandatory in
esto porque
cancer
nos va a
and
permitir
NNA,
la
because this
trazabilidad
is
de
going
todos
to allow
aquellos
them
que
to have
puedan
traceability
beneficiarse
of
de estos
anyone that could be
medicamentos
benefited by these
para poder
by these
monitorizar
medications in order to be
trabajar
able to
en
work
alcanzar este
in
60%
obtaining the
de experiencia y de vida para
60%
el
of
2030.
global survival for the
En
year 2030. Next one, please.
cuanto a la gestión clínica,
In reference to clinical management,
nuestros logros más grandes, creo que
our
podemos
largest
decir que es el
achievements
consenso de los esquemas
is the
terapéuticos y haber
consensus of
logrado su
therapeutical ends and
socialización
to
a
be
la
able
red
to arrive on a
de salud
socialization
a
in the health
partir de enero del
network
2025.
since May
Asimismo, la
2025.
publicación
At the
del
same time,
curso
the
virtual de
publication of the
recomendaciones básicas
virtual
para
course of
fisioterapia
basic
y
recommendations
el apoyo
and
financiero,
also the financial
logístico
support,
y
logistic
definitivamente
support,
humano que
and
hemos
definitive
tenido
human
para
support that
mejorar
we've
lo
had
que
in
eran
order
las
to improve
instalaciones donde se iban
the
a procesar,
facilities where we are
almacenar
going to
preparar
and store,
medicamentos
prepare
en los 5
medication
hospitales
in
que
the
forman
5
parte
hospitals that form part
de la red
of
pública
the
y
public
que se
network
benefician en esta
and
fase uno de estos medicamentos, a
that are
saber,
benefited
Casa
in this
Bustamante,
phase
Diana
one, talking
Curtis,
about Casa
quienes son los
Bustamante,
principales
Cortis
exponentes
as
en
our
atención
main
pediátrica en la
presenters
región
and
costa
pediatric
y sierra
assistants in
respectivamente.
the coast and the highlands
Siguiente
area of
diapositiva.
the country.
Y aquí tenemos ciertas imágenes, ¿no?
Here we
Se
have some
enfocan en
images.
realidad
There are very
para
few
poder
actually
evidenciar lo
to
que
be
fue
able
el
to create
cambio,
evidence in
como
reference
decía
to
Jenny,
what the
del antes y el
change
después.
was before and
Definitivamente hay un
after.
antes y un después.
Definitely there is a before and an after.
Estamos
And
hablando de que hemos
we are talking
cambiado el
about the
método
fact
de
that we've
estimación que
changed
ya
the
no se
method of
basa
estimation
en
that
el
is no
consumo
longer
promedio
based
mensual
in the monthly
únicamente,
average
estamos hablando
consumption,
de
but
una
we are
estimación
talking
basada en un
about
método de morbilidad
an
que
estimate based
actualmente
on a mobility rate
está
that
en
currently is
curso las
in course
capacitaciones a
in
todos los
reference to the
actores que
trainings to all of the
participamos de
actors
esas
that
estimaciones.
participate of these
Cambiar lo que
estimates
eran las
to
bodegas
change
al
what
lado izquierdo
stores would
y lo que actualmente son en el lado
look like. And
derecho,
currently,
el uso
we
de
have on the
equipos de
right side
protección
the
personal
use of
para el
personal protection
personal que
equipment
recepta esta
for
medicación y que la va a trasladar hasta los
people that are going
lugares
to be able
donde
to translate this
finalmente
onto
los hospitales lo van
places
a
where
poder
at
almacenar
the end of the day
y
you're going
preparar
to be
de
able
la
to
manera
store
más
and
segura
prepare this in
para
the safest
suministrarlo
manner
en esa
to be
misma
able to
línea
administrate
al
it in that
paciente que
same
lo
line to the
necesite,
patient that needs
¿no?
it. Okay,
Siguiente diapositiva.
next slide, please.
Y esta diapositiva también la
And this
utilizan
slide,
varias, en varias
imagine you've seen it
presentaciones,
in many
pero
presentations, but
estas letras en rojo que dicen
these
desarrollo es algo que no estaba antes.
here in
Y no
reference to what
estaba
was in
antes
red,
porque
it's
en
something that wasn't here
realidad
before because
estábamos
in
todavía
reality,
determinando
we're
cómo
still quite determining
avanzar,
how it is that
cómo
we're able to have progress.
aterrizarlo a
How are we
unos
able to
planos
land this
y
onto a
a una
plan,
hoja
an
de ruta,
objective,
¿no?
a route
Entonces,
sheet? So
si bien
Although we know that challenges can become opportunities to reinforce health systems such as ours in countries of a very low and medium income, we need to be able to identify what are the parts that we need to have an intervention, the areas of opportunity, and also in reference to the organization of services. Here we can actually say that this gives us work in territory to be able to establish the different oncological networks with the objective of reducing reference to being able to establish this, what takes us to these excellent centers, which are hospitals that are benefited from the medications and aided by different entities. At the same time, we are working in the training of the human resource, promoting, first of all, the stability of focus points. Since I'm a focus point, there are focus points to be able to train staff, and therefore we are in monitoring and constant follow-up. At the same time, we are with another group moving this from the policies of non-communicable illnesses that already mentioned cancer and the LNA, and so with the commitment of being able to have at the end of this year a strategic plan that's very much specific for cancer and NNA, because we already have this in the regulatory agency. I will not finish without saying that if there is not a lead, if there is not a clear objective, if there is not a group focused on the governance, we are not going to be able to have changes in the system. We're not going to be able to empower the collaborators and different actors. Because at the end of the day, this is not one person's job or one team's job. No, this is something that should be articulated and in constant interaction, because the national context of our countries are complex. The high rotation of people and staff is real, and that's why that always may lead to fragmented health services. In the middle of a part of this, the only way of having success is to be able to work for a multi-sectorial participation with a common objective. Here we have a more updated picture, I think, from July this year. And with those ads to people that represent the institutions within the National Commission of Cancer. I also want to mention that we have Bonanza and the different public health and public ministry of health, and also have members of the civil society. And this is the Equatorial Federation of Palliative, of course, palliative cares. Here we have everyone here working for a different future for NNA with cancer. Thank you very much.
Muchas gracias, doctora Maramol, por su
Thank you
valiosa
very much, Doctor, for your very valuable presentation and for sharing the
en
experience of
ejercicio de los
Ecuador
protocolos
in the
estándares mínimos
process of
requeridos
meeting
para
the minimum
acceder
standards
a los
required
beneficios de la plataforma
to
global
be
para el
able to
acceso a
have
medicamentos para el
global
cáncer infantil.
access for
A
access
continuación,
or
continuamos con la experiencia de El
medication for
Salvador, país que
children
forma
with
parte de
cancer.
la
We
segunda
now have the
cohorte de
experience of El
implementación de esta
Salvador
importante
in
plataforma.
reference to this
Por
very
ello, es
important
para mí un
platform.
honor
For
presentar a
me,
la
it is an
doctora
honor
Andrea
to
Chacón,
introduce
médico
Dr.
especialista y
Andrea
responsable del
Chacon,
componente de cáncer en la
responsible of the cancer
Ministerio de Salud
component
de El Salvador. Doctora Chacón ha
in El
sido
Salvador.
un
Dr.
profesional
Chacon
nacional
has
y una
been the
pieza
national
clave en
focus
liderar la
point and a key
implementación de la
piece
plataforma,
in the implementation of the
articulando esfuerzos
platform,
en entre el Ministerio de
articulating
Salud, los
efforts
equipos clínicos y los
in
socios
efforts of being able to
internacionales con
see
el
the
objetivo de
international
garantizar que los niños y
partners to be
adolescentes
able to
con cáncer
guarantee that they have
y equitativo
that there's able to
medicamentos.
be everything in
Doctora
quite
Chacón, le damos la más
the
cordial
same way.
bienvenida y le
And Dr.
cedemos la
Chacon, we
palabra
will
para
give
que
you a
usted
warm
nos comparta
welcome and we'll give you the
experiencia
floor
del
so you
Salvador.
can start sharing the
Adelante.
experience of El Salvador. Go right ahead.
Buenos días, mucho
Good
gusto, un
morning. It
honor
is a
estar este
pleasure
día
for me to be
compartiendo
here
con
with you
ustedes.
today, sharing
Trato de septiembre
this
dorado,
information
un mes
in the
muy
month of
importante en
September,
todo
which
el
is a
trabajo que
very
se está
important
realizando
month in all the work that
contra
is
el
being
cáncer
done
pediátrico.
against this
Agradeciendo
pediatric
la
cancer.
presentación de
We would
doctora
like to
Swan,
thank Dr. Swan for her
decirles que
presentation and to also
tengo
say
la
that I
dicha de
have
poder compartir
the
hasta el
honor of being
momento
able to
el proceso
share,
y las
at least
experiencias que
until
hemos
now, the
ido
processes and
adquiriendo
experiences that we've been
en cuanto al
acquiring
proceso de
in
implementación de
reference to the process of
la plataforma
implementation
global
of
para
the
acceso a
global platform for
medicamentos
access to
oncológicos
medication,
pediátricos en
oncological and
El Salvador. Bien,
pediatric components. Next one, please. We're going to take this first to a national context, and then it's about trying to identify how we have been taking these phases of implementation of the platform, a process that has been for us something important. And it's also going to have some images here so that we can illustrate these stages and the conclusions for us that we've prepared from the beginning of the process. Next one, please. First, I would like to say that we are a Central American country that has a population of over 2 million people that are under the age of 19. Seeing this in a percentage, this is around 34.3% of the population. If we talk about the oncological diagnosis, for us, leukemia, lymphomas, tumors of the main nervous system, and for bone as well, are within the most frequent diagnoses that we have. And if you're able to see in terms of the work that is being done, we have a global survival of all the tumors globally from our country that are being treated, which is a 54%. This has been obtained from an analysis of 5 years, has been done from the register of pediatric cancer cases, and in average, we have 252 cases that are being diagnosed in under 19. We have a national hospital that works, Benjamin Blue, that's the hospital that works together with the Foundation IDBB, which is our main center of national reference. And we also have a unit of the teenagers to be able to work with the same hospitals of the third level that we currently have in our countries. All of the pediatric oncologists have this. It's been estimated that we have an intervalue between the diagnosis that is less than 30 days that is being given reference to 99 cases that have been identified. And less than one treatment, those that abandon the treatment. This comes from the analysis that has been done in reference to the cancer registrations, in reference to the population that we have in the country. And we also need to see that we are actually setting everything by standard use, all the uh, treatment ends that we've been working together and to support throughout this whole process. Once this is already incorporated in the global initiative against child cancer that is within here, this part. Here that we have for 2021 and 2025, and here this was given within the efforts that we have to be able to update all of this information. We also have protocols for the treatment of our child cancer cases, and we also have early diagnosis standards for child cancer, where we're able to establish what is the difference, the route of difference for our children. Obviously, here we as a country are working as an alliance, the National Alliance for the Prevention and Control of Cancer, where we are including all of the institutions of the health sector, plus also institutions or organizations of civil society, and for the part of the society as well. Seeing this whole part, it is important to be able to establish that we have been working to be able to optimize all of the efforts in the country in a way that since May 2021, we have the signature of the letter from Minister of Health, Dr. Francisco Lavid, in order to be able to have our country become a focus point in the global initiative against child cancer, and also to be able to add all of these efforts that we knew were a challenge. And also, of course, meeting all of these pillars that we have to be able to have progress in this whole approach process of child cancer in the country. Next one, please. In the same way, we also had set the route to be able to implement the platform of access and to this. And once we have here this information, we are able to establish of being everything set here in these pillars that will give us the global initiative throughout the technical package of having our excellence centers, our staff, of having a correct identification of the treatments, and to be able to have the standards, to have the execution. I mean, everything that we already know, the pillars and the support that should be set here. And it's about saying, in order for us to give another step, we need to request to be able to have access to the platform of ecological medication. And that is how and there are all of the phases for this process of implementation set. Of course, first seeing that we have certain guidelines and that we know that they are being met, we requested to be a part of this process in February this year. We had this participation from the Ministry of Health in reference to being able to see the impact that we have and to be able to begin with the authorization from the title holder of this entity of health of the country. And we were passed on to delivering the request, and we obtained the acceptance by PAHO and OMS, and sorry, WHO, of being able to establish access to be able to have the support of PAHO, WHO, and St. Jude's Hospital to be in this process. Once we have this process set in reference to this acceptance letter, we pass on to be able to prepare the legal document for the platform, which is the understanding letter that we currently have in reference to this process. In reference to being able to establish, and after having seen this framework, then obviously we need to be able to have a team of work. So we were able to appoint a focal point, which in this case is myself, and also we were able to see and form a work team that focuses on all of these areas that need to use this whole processes in the use of medication, considering that we needed to include the a team from elements that we have to include for a planification, seeing how we're going to have all of these estimates of these medications based on being able to see where the basic diagnosis, the process of reception, receiving, customs, everything that is being done throughout the whole process in the main storage to be able to take all of this at a hospital level and pharmacy, and also the different service for its application in patients. We also needed to fill out a document to be able to receive all of these or to know all of these weak points that we had throughout this whole process. And then later on, of course, we were able to receive this documentation to be able to evaluate this whole process through some matrices that we were able to fill out, and that when we were going to receive the information of exports, which is the following phase in reference to capacities, and we had a whole group of from the WHO, PAHO, and St. Jude's Hospital to be able to know about all of these points and chains to be able to see how we were doing, if we had the enough capacity, but we needed to improve points. That was from April 25th to April 26th. And then once we had all of this, we started seeing it was going to be a selection of documents that was already set in reference to what we already have the health centers that have been selected. In this case, Lu and Rosal Hospital, in reference to the demand of patients that have been estimated. And we also had this part of in reference to this part here, in reference to this end, to be able to have this unified and to have this set in a document. In other words, you're going to see that we go step by step to be able to see if we had other points, other weak points, to be able to overcome them. And this resulted from this analysis that was done in reference to filling out of this matrix, which is finishing with the visit of experts. And after this, in reference to be able to overcome all of this and have a schedule of work, we had an operational plan that was elaborated that includes all of the organized and what is going to be done. It talks about governance, forecasting, quantification, technical aspects, management, of supplies, follow-up, and presentation of reports. And again, we are having all this in execution, and here we're trying to see the observations that have been observed, and this also includes the development of operational procedures that have been standardized for each one of the areas to be able to have all of the processes that have been standardized and to have any weak points in these aspects. And our projectors and reference to being able to set this in reference for this last quarter of this year, and here to be able to set here in reference to the request letters that we have, and there's reference to these processes. Here, this is in reference to what is being said here. The National Work Committee, this was formed for all of the areas, and here we have the direction of policies, the Office of Communicable Offices, Communicable Diseases, the legal and the hospitals in reference to the foundation, and also in a sanitary regulation, which is very important in reference to having the incorporation of medications to the countries, and then they pass on to this part of the ministry.
We also have the expert mission we had on April 25th. Next, please. The previous picture was from the minister, and we presented everything we had as a summary of the diagnosis. Then we had visits to hospitals and warehouses, to Rosales and the central warehouse, to these different areas. And the experts went to check what we were going to present. And there are still some challenges we are overcoming in our operational plan. This was the mission conclusion, what we achieved, and all the different tasks we had pending to continue with the operational plan and to continue executing it. As a conclusion, we can say that we will have access to 33 medications for treatment protocols. We will have a coverage for an average of 258 children under 19 years old, and we expect an increase in survival rate of over 60%. This is a guided monitor and assess process from medication planning and scheduling to its administration to patients, ensuring optimal and transparent medication management to guarantee compliance for each scheduled patient. And special acknowledgement to our team working in this program, and to PAHO experts for supporting us so this strategy could be implemented, and we will know that we will continue implementing all these capacities so we can improve comprehensive attention, comprehensive care for our patients and the adherence to treatment. And for us, it's so important because with this, we hope we can achieve the goal of a survival rate of over 60% for all children and adolescents with cancer. This is what I wanted to share with you. Thank you. Thank you, Dr. Chacon, for all your experiences. These are excellent examples of leadership, progress. We have colleagues from Asia, Africa, and other regions. Many of these countries, which are part of this magnificent global platform, which are implementing all these experiences, is really good. It's special to share what we're doing in these countries and see how this is progressing. That's why Gold September, we are in gold, dressing in gold color, because children are important. Thank you, Dr. Chacon, for all your work and all the teams behind it. This is not just one person. work. Thank you all. And now we pass the floor to Dr. Catherine G. Lam for the second part of this important work that St. Jude does, and how this can be applied on the framework of Cure All and Children Cancer. Dr. Catherine Lam is the Health Systems Unit of St. Jude Children's Research Hospital and co-director of WHO Collaborating Center for Childhood Cancer. Welcome. I don't know if you're going to speak in English or Spanish. Please go ahead. Thank you, Liliana, and everyone. I'm pleased to be here with you to discuss on how to promote the access of medication, of medicines for childhood cancer to improve the access and treatment for everyone. To start, we wanted to use a common language with you and the global community. We have created ways of seeing the needs of children with cancer within the health system. And we can see in orange all the needs that are for cure-all framework. Technology, medicines, which is our important topic. A common question: how can empower cure-all to all society so we can ensure this for all the community? That's why we established NCCP. It's a 6-month program for ministry teams, national cancer control planning, with different keys of cure-all, offering a structure for participations among ministries, clinicians, civil society, and researchers by applying frameworks and guided questions for reflection and homework exercises, applying system thinking and contextual frameworks, evidence based on more than 2,000 pages of references and real-life scenarios from countries of national policies, legislation, and grammars. We have different countries all over the world from more than 75 countries, reaching 70 teams led by ministries in 39 countries. This year, we have reached 28 countries in 62 cities with 32 country teams. The cohort this year has 6 countries of this region, including ministries, clinicians, and foundations. Our approach is the national cancer control, including items 2, 5, and 6, the ones in orange that are related to this work. And as you can see, Cure-All framework is included in the sessions for the cohort. In May, we cover teams discuss of pillars, introduction of pillars, and in June, pillar R and pillar E. We want to cultivate and share language relevant evidence for policy and policies relevant to pediatrics. Many participants are familiarized with the general concepts of the pillar and the facilitators. Most of them don't work exclusively with children or politics or with the policies, exclusively, but with global available areas. NCCPICAY provides evidence and practice from publications and platforms. for example. You can use resources from WHO and EIEA resources, including priority medical devices, essential diagnostics lists, essential medicines lists, as well as resources to help adapt these global lists or recommendations to national settings to enable prioritization. So with this, we have the opportunity to apply tools developed with children with cancer in mind to assess and define measures appropriate to the purpose and context, including CED core essential diagnostics and area guidance. It's important to adopt an integrated comprehensive therapeutic approach rather than considering diagnosis or medicine in isolation. And because of this, it's important to have this thought modeling that is systemic. In each session, we ask the teams to complete 3 works on key questions or lessons learned. Here you can see some of the selected topics by Pillar R pre-work. Timely access to quality diagnostics and medicines, standardization of treatment regimes, national list of essential diagnostics and medicines, among others. To learn more, join NCCP ICAIA Capstone 2025 and engage your national team for 2026. This final open session is going to include reflections and key works with our cohorts, with reflection on the 6-month invitation-only workshop series with 32 ministry-led teams in 6 WHO regions. Focus countries, more than 53, focus countries, 11 countries with activities, and 20 countries in dialogue. Here you can see some evidence of the work we've been doing with tools to improve clinical care in Colombia and work practices in Mongolia. We are also interested in continuing working with the different countries participating in the global platform for access to pediatric oncology medicines. So we can continue working in these initiatives, and we are going to include new ways to implement health systems. Progress and the results in access to medicines are not limited to 1 or 2 countries. In 2018, we have reached more than 100 projects in the Americas, PAHO region, and also facilitators, including Pillar R. To continue with sustainable access, we need sustainable political will. We will continue working on these matters in the future. And by the philosopher words, who has hope and health has everything. And thank you for everything you do to take health and hope to many more children all over the world. And thank you very much to Melissa, Patricia, and the whole team of St. Jude, Silvana, Mauricio, Eliana, and all PAHO team. Thank you very much.
Muchas gracias,
Thank you,
Catlan,
Dr. Catlam,
por su presentación y por
for
compartir
your
con nosotros
presentation
la
and for
relevancia de los planes
sharing with
nacionales
us
de cáncer infantil y
all
del
the
trabajo de la
different
iniciativa
plans,
de ICAIA, así como el enfoque
as well as the
regular de
approach
regímenes de tratamiento. Ahora tenemos
of
el gusto de
treatment
continuar con la
regimes.
experiencia de Chile, un
Now
país
we
que ha
have
mostrado un
Chile
liderazgo
experience,
destacado en la
a country
implementación
that
de
has
metas y
shown
estrategias para el cáncer
their
infantil y
leadership
adolescente dentro de su Plan Nacional de Cáncer, por lo que
in
es para mí
their
un honor presentar a mi
national
querida
cancer
colega y
plan.
amiga, doctora
I'm
Julia
going
Palma
to
Gómez.
present Dr.
Ella es
Julia Palma,
hematoncóloga, coordinadora del equipo
pediatrician,
asistencial en cáncer
oncological
infantil-adolescente,
pediatrician,
coordinadora nacional del Grupo PINDA,
working with children and
dirige el programa
adolescents
infantil de drogas
in
antineoplásicas
a
y coordinadora del Comité de Trasplante
program
de
in
Progenitora
Chile and the coordinator of the
Chile. y también directora
of
asociada de St. Jude Children's Research Hospital para
cancer in Chile and
el programa
also
regional de Sudamérica.
working in the Cabinet of Chilean
Los
Ministry of
países
Health.
andinos. La doctora Palma también forma parte
Dr. Palma
del
is also part
departamento de la Agencia Nacional del Cáncer y
of
del Gabinete
the Cancer
Administrativo,
Agency,
desde donde ha contribuido
where she has
significativamente a
contributed
consolidar avances en la atención
on the
preventiva clínica del
progress
cáncer infantil.
of
Y hoy nos
clinical
compartirá
treatment,
experiencia
and
de
today
Chile y su
she's going
liderazgo
to
en la
share
iniciativa de planes
Chilean
nacionales
experience
Ciclicaya con un enfoque particular del
on
plan de
the
2020.
national report within the framework goal of
Doctora Palma, le
September
damos la más
2025.
cordial bienvenida y le cedemos la palabra.
Welcome and thank you for being here. We pass the floor to you, Dr. Palma. Thank you very much. I'm pleased to be here representing Chile on behalf of Chile for everyone who works in the cabinet from assistant network on the medication supplies for my country. The aim of my presentation is to approach all what Chile has learned in the two participation periods with NCCP, ICAI, and also looking at the national perspective where the pillar R is one of the national pillars in terms of action plan. This pillar has been fundamental and an important progress with history, national context, where Chile since 1988 has been working in an articulated manner in the network with palliative care, transplant area, and with the his coverage since 2005.
From a perspective from the ministries of health that we've had in a consecutive manner. And this is how, after this, we have a legal framework with the National Cancer Law that establishes a guarantee of access and opportunities and equity, having a national cancer plan that has as a base the diagnosis done with profile and its action plan throughout the pillars. And we have a focus of equity in reference to the current government and in terms of reducing gaps of access to medication and therapies in the independent group of the independently from the socioeconomic status. Considering here therapies, here not only seeing medication, but also the concept of advanced therapies. We do understand that this question, in reference to the equitative access to this assistance of high cost, for Chile imply the response to what is currently active in the clinical practice guide to rehab challenge, which is about having equitative access to medications of high cost into an essential medication. And we're going to see how we start breaking down the presentation in reference to essential medications that are available for Chile according to the platform and according to the fact that Chile also participated in reference to ensure the availability of medication in a sustained manner. We have this list of medications, essential medications, that are a part of what we have in the World Health Organization. And as a country, we also have the duty of giving a guarantee and traceability of medications that we are purchasing for national level. And that is how we see that these essential documents need to be surveilled throughout two structures, which are the Public Health Organization and also the National Supply Center of Chile, which have this part in reference to what is important of difficult access for our patients. And this implies a permanent and since that we are reviewing this list to be able to have access in reference to what is available as well as the logistic coordination with us being able to see this essential this essential drugs that can be distributed in an equal manner throughout the whole territory. Now, we've had situations in reference to this stock of essential medication in Chile, which has been very important and has been seen in reference to this cancer plan, and this has been indifferent. And to see this as what was mentioned by Dr. Vasquez as potential consequences in reference to the risk, reference to importation of emergencies that can be occurred here, as well as the need of having a response to being able to test our institutional and to be able to have these decisions made. Of course, these strategies have to be done together, as it was mentioned in reference to PAHO, to be able to have medication sets, medications that are important that have a guarantee. It is important to be able to authorize the specific acquisition and extraordinary acquisitions in specific cases, and also regional ends to be able to obtain these regional lists in response to what is required in reference to being able to have this sustained. It is very important to have the integration that today Chile is able to recognize as necessary in reference to the regional integration. And that is how, in reference to this end, our capacities of response have been purchases and national registries, and also the integration of stocks and the staff that is left here in reference to being able to see that the surveillance needs to be articulated to be able to see these needs. According to the high cost medication, which is the other larger chapter, we have the high cost fund in Chile that becomes makes Chile a pioneer in being able to have access to innovative services that were first for the first world. But I do not think they were in countries that do not have development or capacity of access. In the year 2024, we were able to work on a map together with the National Cancer Plan that is currently covered in reference to being able to see this high risk and people below the age of 15. We have different ends that currently we have the assessment for new medication, Erwinasa, Evinonimus, and among others, to be able to improve our portfolio. And to this high cost medications, we have the implication of a shared risk agreements. There are national agreements that are seen as countries and also with governments to be able to facilitate the entrance of this innovative medication. We have the fund of high cost drugs, which implies a fund of $70 million on an annual basis for oncological medication. And there are new drugs and studies to being able to have access to this fund. And we also have the regulatory reliance, where the public health institute is able to facilitate the entrance of this high cost drugs, which is very important to be able to have opportunity, access, and quality, as we mentioned before. And at the level of regional policy, we are just seeing technologies, and Chile is forming part of this regional in reference to the regulatory fund to be able to have the correct and for cost. And we're also working with the regional platform of innovation, access to medication and sanitary technology to be able to have an articulation. Our countries definitely require a lot of technical and regulatory support to be able to see the level of medications that we are able to incorporate step by step. And here, in the same sense, to our patients here, we have the patient under the concept of progressive autonomy in Chile, where we are able to have the incorporation in the voice of teenagers, children, and their families making in terms of their own requirements. In that same context, we have the accountability as something that is very important. We need to be able to have a constant monitoring, the transparency in reference to the efficiency of the implementation of these different strategies. And we also have important information regarding our patient and giving them the framework of the National Cancer Plan. This one works as an articulator, and it should also be articulated with strategic facilitators that are sustainable in governance to be able to implement these strategies of acquisition of medication. Finally, it is just to comment that we have some challenges and opportunities in reference to essential medication, needs of integration, guarantee of the quality of medications, to be able to work with regional support systems, and to have a national monitoring to be able to definitely give accountability in reference to the progress that we've had. This framework of the National Cancer Plan, with the work that we've done with NCCP ICAIA throughout the second year, definitely allows us to work with an international reference and to be able to align the different actors, both from the ministry and outside of it, together with the National Cancer Commission that also exists in Chile, to be able to have progress in reference to these group of actors that are necessary to be able to respond to the need of medication in Chile. We would like to thank all of our families, patients, health staff, organizations that make this commitment possible from the Ministry of Health. We would like to definitely thank the fact that Chile, together with collaborative supports and also with strategic alliances in reference to child cancer, and we also have a shared hope, as we've seen with our other presenters, in reference to this connective effort to be able to have a more equal future for our boys, girls, and teenagers with cancer. Thank you very much. Thank you very much, Dr. Palma, for sharing your experience in reference to what has been explained for all of the work that is being done in Chile. As always, Chile is one of the countries in the region that already has exceeded their goal in reference to global survival over 60%, and much more, actually over 80%, according to the last statistics. So we are all wanting to learn from the experiences that Dr. Palma is able to provide to us with much effort. We are now going to pass on to the Dominican Republic, that is also going to present a very important, relevant example in the region from Central America. We have Andeliz de la Rosa, who is in charge of the Non-Communicable Diseases Department for the Ministry of Health in the Dominican Republic. It is a pleasure to have her here with us. Go right ahead. Hello, good morning to everyone. Can you all hear me well? Excellent. Okay, very good. Well, thank you with everyone. Good morning. Apologies, I was able to join late. And I was able to, well, unfortunately, I was able to hear Chile's presentation. Chile is one of the platforms in reference to primary assistance and many of the topics that are seen here, and that we should continue seeing as an example. So thank you very much to the doctor here. We as a country, we are going to present the progress in the R pillar in reference to regimens and treatments that we've done in the country. And I am not able to control the presentation. Thank you, Patricia. Dominican Republic forms part of the initiative. We have the goal of every country of being able to at least try 60% in children and teenagers with cancer for diagnosis to the year 2030. And that, well, what we all want is to be able to increase the capacities of countries to provide quality services. It's to be able to prioritize child cancer at a local, regional, national level. We've had actions that have been done in reference to both objectives. Next one, please. We are in reference to being able to set this part. All of these actions have been aligned in our countries, and not only to reduce a pathology, but to reduce a group of pathologies prioritized for the countries. Child cancer is one of them. And we are definitely proud and happy of being able to work for the next objectives. The milestones, I will mention them here. I think that this is about, we are able to see here for our countries in 2019 with the creation of the National Technical Committee for the year 2019 that began here in reference to the preparation of the elaboration of this end for cancer. We are able to see here in the conceptualization, international support, we were able to launch the campaign of early detection in reference to these symptoms that has been implemented on a national basis. Throughout this, we've been able to have the support in March 2024 of the creation of the chapter of pediatric oncology of this, and we've also had progress with the creation of the manual in reference to procedures of early detection of child cancer for boys, girls, and adolescents, led for these levels of assistance in our countries that are less specialized, and that has been extremely important. In February 2023, we had the creation of the basic course of child cancer that is set here specific to pediatricians for the early diagnosis of child cancer and then led to other.
Debe de estar por ahí. Ha sido un trabajo encomiable que ha hecho la sociedad, no solamente dirigido a un capítulo de especialistas, sino dirigido a aquellas personas que tenemos desde el primer contacto con niños, niñas y adolescentes, escuelas, instituciones gubernamentales que tienen que ver con la educación, con el primer contacto, y eso ha sido fundamental para nosotros. Próximo. En septiembre del 2023,
in September 2023, we launched our plan. We had the renovation of the surgical wing and kitchen at Dr. Robert Reed Cabral Hospital. And the First Lady of the Republic delivered the hospital, and we started in February 2024 the comprehensive care program for adolescents and children, focused on the work we did with you. In March 2024, we got the poster in Curol, and in March 2024, we inaugurated our in-card pediatric oncology unit, and with that, we felt really proud. It was a collaborative and comprehensive work which was for the specialized area in our country. We published articles in the Pan American Journal of Public Health. For us, it's important to document the scientific area of all we've been doing, and we feel proud of all these actions that have been key. Next, please.
No lo logro ver completamente.
Apologies, I can't see very well.
Me escuchan bien?
Can you hear me well?
Ver la pantalla.
I can't see my screen. Yes, we can hear you,
Soy yo que no
Angelis.
puedo ver la pantalla.
It's me. I can't see my screen. Apologies.
No sé por qué no puedo ver la pantalla.
I'm not sure why I can't see my screen. Can you see it?
Okay, ahora sí.
Okay, now I see it.
Pues tenemos
To finish,
de políticas públicas. Nosotros,
we had the Public Policies Forum with Cure All that was focused on the health system. We put all the different health system people, the coverage area, clinical area, specialized society, and on December 2024, we launched the protocols for the management of this, but Hodgkin's and non-Hodgkin's lymphoma, so we could see the opportunities we should work on with the progress we achieved. And with that, we had the national table on civil society, international coverage. And with that, I think that was the most important pillar. First of all, because we have identified what are the things that are not covered in our health system through pediatricians, oncologists, pediatricians, and other specialists. So this coverage focused on cost studies and see how these patients, in terms of procedures and medications, they could be covered. We have also identified the clinical protocols with the government and to see how we could prioritize this. In that sense, we launched our protocols in December 2024. on management of Hodgkin's and non-Hodgkin's lymphoma, as I said before. And we also relaunched the Children's Cancer Campaign, and we were really happy that we won the poster cure all for February 2025. And in June, in August, we had our procedures manual of allogenic transplant of progenitor cells. And this week we have launched this on the framework of this month. This protocol is very important because it's starting with a request at a national level, starting transplants in our country. This has been a movement of the specialized society to sending these clinicians so they can start with transplants, and we hope that we could achieve this very soon.
Ahí está la inauguración de la unidad oncopediátrica del
Here you can see the inauguration of the INCAR Pediatric Oncology Unit, the president, the first lady, and the team. Next, please. This is the first workshop for adolescents on empowerment that we did with makeup, personal care. This was one of the initiatives we performed with the society. Next, please.
Esta es una de las
de lo que presentamos, ¿verdad? What we submitted in the case of Dominican Republic cases in oncology, of what we discussed. And this is something
sentimos que hemos avanzado.
We feel we progressed a lot, prioritize the medicine through the protocols and through tertiary hospitals has filled the gap in the case of costs. We have not only made these technical meetings, but videos, documentaries, not only for documenting what is happening with the families or relatives, but to see what happens from the houses to the hospital, from the hospital to the families' houses, what is the process the families deal with. So this is top level analysis, and this made ministries to see and to cover and to desire to cover what is happening and to provide this comprehensive coverage. Next, please. This is the National Forum on Public Policy on Childhood Cancer that I mentioned before. I was in the United Nations there, and it was a virtual presentation. This was very important. The support of PAHO and St. Jude has been fundamental for our work. We have been guided through this strategy, and we try to follow all what we understood from the national strategy. Next, please. This is the technical roundtable, as I mentioned before, the civil society, specialized societies, the First Lady of the Dominican Republic, working on the different procedures, medicines that are not covered, that were not covered, that should be covered by the country, and how we have been progressing. The procedural manual for early detection of cancer in children and adolescents, that is virtual. It's a didactic, pedagogical manual. This is the national strategic plan for childhood cancer. And these are the two protocols we started working in December 2024. And now I think the last part and the most important part, apart from the transplant protocols, is the beginning of the implementation of the National Cancer Registry. We have started with this pilot, with this National Cancer Registry, and the ministry has decided that the initial pilot starts. We have visited the unit with Dr. Miguelina and the oncologists, pediatricians in our country, supported by the civil society, visited the different hospitals to see how or what this database is, so we can pilot our first national registry of childhood cancer. The first thing we did was to update the ministry resolution establishing mandatory reporting of cancer diagnosis. That was really important as our priorities. And the creation of platform for National Cancer Registry aligned with the National Digital Health Strategy. And the general objective was to implement a modern, secure, and sustainable platform to consolidate cancer registry data in the Dominican Republic that is reliable, timely, and comparable for clinical, epidemiological, and public policy decision-making. We have a strategic approach by stages. Stage 1, implementation of childhood cancer module of the National Cancer Registry, where we are now seeing the different interconnectedness parts from one hospital to another hospital with the public health ministry. And the second stage would be expansion of the National Cancer Registry. We hope that the next year we have the first pilot. This is the protocol we launched last week, which makes us proud. And apart from this protocol, we expect that we could say that all these protocols will be the ones that will be covered in our country. Thank you very much. My niece, this is my niece. She didn't survive, but I always put her picture in my presentations in Dominican Republic. We feel proud that we are working on all this. Being humble, seeing the examples of other countries with a comprehensive context that is important, and we also feel that we feel humble that we're taking all the examples of other countries so we can do what they are doing better. Thank you very much.
Muchas gracias, doctora de la Rosa, por su valiosa intervención.
Thank you very much, Dr. De La Rosa, for your very valuable presentation to be able to share with us the progress of the Dominican Republic. And now we will present a message in a video of Dr. Christopher Lee, that is the head of the Strategic Fund of PAHO. It is a message to be able to highlight the importance of access to medication in the regional cooperation to being able to reinforce this matter. We're going to put the video then. Thank you.
Good morning, fellow colleagues and Feliz Septembre Dorado. The gold ribbon reminds us why we're here today. That's because every child in every country deserves a fair chance to survive cancer and to thrive. My name is Christopher Lim, and I'm the chief of the PAHO Strategic Fund. And I'm glad to be here today to share with you how PAHO interprogrammatically through PAHO Strategic Fund is turning that promise into practical results with the Global Platform for Access to Childhood Cancer Medicines, or GPACCM for short, together with St. Jude's and also WHO. First, on the challenge. Now, too many children are facing delays in diagnosis, inconsistent treatment, and heartbreaking stockouts. Families do not experience what we go through as programs or projects. What they experience is whether the right medicines, tests, and trained teams are there on the day when they need them. And our job is to make the answer yes, at each and every time. Now, what is PAHO's value add to all this? We bring together three strengths that together changes the game. Firstly, technical cooperation in childhood cancer. We help to standardize protocols, training, and quality systems across care pathway. Secondly, is the strong regional procurement capacity through the PAHO Strategic Fund. Food demand, quality assuring sourcing, and market shaping that makes prices predictable and supply reliable. Thirdly, a platform mindset, connecting clinical standards, regulatory pathways, financing, and supply chain so that countries can move from pilots to programs at scale. Now, how does all this work in practice? First, selection and protocols. Countries adopt the same priority medicines and dosing schedules among all hospitals. Second, quality and regulations. We rely on WHO pre-qualification, SRA, and regional regulatory convergence to shorten the time from dossier to delivery. Third, procurement and logistics. The strategic fund aggregates demand, negotiates long-term agreement, and co-chain needs when relevant. Now, you have heard earlier on the success stories from different countries. Now, let me highlight two of them. Ecuador, the first in Americas to implement GPA-CCM, has standardized clinical protocols, trained multidisciplinary teams, and strengthened supply chain management across its pediatric oncology network. In 2025 alone, more than 20 essential cancer medicines and over 23,000 units have reached children and adolescents, including those battling leukemia and solid tumors. Now, equally important, governance is stronger. Childhood cancer medicines is now on the National Medicines List and the National Childhood Cancer Commission, both of which are led by the Ministry of Health. And this brings together all the actors onto one table to sustain progress. Now, next in line in the platform implementation is El Salvador. Now, they have used the technical preparation phase to reinforce diagnostics, update regulatory processes, and strengthen governance, laying a durable foundation for continuous high-quality care as procurement ramps up. Now, these results are no accident. They are the product of congruent policies working together. National selection and protocols that matches what we procure, regulatory reliance that speeds up access, and transparent pricing and long-term agreement that stabilizes budget. When all these pieces are lined up, the strategic fund's pool procurement is not just procurement. It is a catalyst for success in access to medicines. Now, to our government counterparts, your leaderships on protocols, national EML, and budget protection is what turns supply into treatments. To our clinicians and patient groups, your voice keeps the system going. To St. Jude and WHO, thank you for the relentless partnership. This platform exists because we share a single measure of success, and that is to have more children cured closer to where they live. Now, let me close this by saying that behind every of our action, there is a child with a name, a family, and a future. And our North Star is simple: no stockouts, no delay, and no unnecessary loss. With the global platform, the PAHO Strategic Fund, and the commitment of our member states, that future is within reach. And now I'm honored to introduce you to a short video that brings all this effort to life, starting with a powerful story from Ecuador and a look at how countries and partners are building the systems that children deserve. Thank you and enjoy the video.
Para mí la noticia que me dieron del diagnóstico cambió mi vida totalmente, porque nunca pensé que mi hija estuviera con una enfermedad como es la leucemia. Los doctores me supieron decir que ella tiene un tratamiento donde que ella puede vencer a la enfermedad, y la esperanza que nos da es que en un futuro vele a ella que haya salido de esta enfermedad y ella sea el pilar fundamental de otros niños que vienen atrás, ¿no?, con la misma enfermedad, que ella pueda decir: yo pude vencer lo que es el cáncer, pude vencer y ustedes también pueden hacer.
Every child deserves a fair chance to survive cancer, no matter where they are born. In the Americas, this vision is becoming a reality through the Global Platform for Access to Childhood Cancer Medicines, led by the Pan American Health Organization, together with St. Jude Children's Research Hospital, the World Health Organization, and UNICEF. PAHO brings together deep expertise in childhood cancer, strong regional procurement capacity, and the Strategic Fund, a unique mechanism for technical cooperation. Through this combined strength, countries are building lasting capabilities, from standardized clinical protocols to virtual training courses for healthcare professionals. Every medicine delivered, every training session held, is a step forward for health equity. In Ecuador, the first country in the Americas to implement the platform, progress is already visible, including standardizing clinical protocols, training medical teams, and strengthening supply chain management and the pediatric oncology network. In 2025 alone, over 20 different cancer medicines have been delivered, totaling more than 23,500 units, reaching children and adolescents battling leukemia and other solid tumors. Governance has also improved. Childhood cancer medicines are now included in the National Medicines List, and the key stakeholders have come together under the National Childhood Cancer Commission, led by the Ministry of Health. In El Salvador, the next country to benefit, the technical preparation phase has strengthened diagnostic capabilities, updated regulatory processes, and supported the strengthening of governance structures in childhood cancer. The technical assessment and multi-sectoral coordination lay the foundation for girls, boys, and adolescents to give continuous and high-quality care. This is just the beginning. Thousands of children and adolescents rely on this joint effort. The Global Platform for Access to Childhood Cancer Medicines is committed to continuing the delivery of essential medicines across the region. United, we save lives.
Yo me llamo Yamireta Guaguiña y tengo 3 añitos. Quiero darle las gracias a los doctores y a las migraciones que me están poniendo aquí. Que yo quiero es sanarme, curarme y estar en mi casita muy feliz.
Es muy emocionante después del video poder retomar la
After the
moderación,
video, it's very difficult to start with the
porque
moderation
realmente
again,
ese mensaje
because
nos
obviously that
resinúa
message takes us back
a lo que
to
venimos, ¿no? El
what we
objetivo
are here
principal,
for,
que
the
es
main
trabajar
objective,
por los
which is
niños,
to
por
be
las
able to
niñas,
work
por
for
los
our
niños y
children,
adolescentes con
for our
cáncer en
boys,
la
our
región
girls, our
y
adolescents with
sumar
cancer in the
esfuerzos
region,
para que eso
and to join
suceda.
efforts for this to
Le doy
happen.
pase al doctor
I will
Mauricio
now give
Maza,
the floor to
cabeza
Mauricio
regional de
Massa,
cáncer, para que nos
Regional
dé un cierre
Cancer
oficial de
Advisor, so he can
Gracias,
officially
Mauricio.
close this event. Thank
Muchísimas
you very much, Mauricio.
gracias.
Thank you.
Bien.
So everyone,
Toby, Santiago,
Toby, Santiago, you were able to give us a explain context of why this initiative is such important throughout the world. We are thankful to be able to see the progress that we've had in the region. Dr. Palma is talking about how Chile is an excellent model to follow at a regional level. The initiatives such as the medication fund to fight costs reinforces the political use, how there is the need of being able to have access to the amount of products available for managing this, not only in pediatrician cancer, also you can always find the support of AHO in reference to this and how it is important in reference to the access to medication. Dr. De La Rosa, thank you very much as well, both professionally and also personally, and in reference to being able to see the creation of the technical committee of child cancer. Here, this process in reference to the launching of this plan to the inauguration of oncological treatment is basically about the whole process and the importance of not seeing this. We are able to congratulate on all the progress that has been done, specifically here right now in El Salvador, that is part of the global platform, and how it has been mentioned, platforms led by WHO, St. Jude's, UNICEF, and we as PAHO, we have a strategic use of our funds. that are quite changeable. And as you can see, Ecuador, it's incredible in reference to the whole transition that is done here. In reference to what has happened, in reference to the development of this implementation process, to be able to have a complete analysis, to be able to make sure that for the valid estimation, when it is all put into practice, how it is that we make this become a reality. Much of what is planned, the designs of the models of training and operational procedures. So for all of this, we're able to see that we had the launching, we had the reception of medication, inclusion of essential medication in the national tables, everything that is needed to be able to have access to this treatment. Just as Dr. Chacol already mentioned in her presentation, this whole phase that was given since the year 2021 for us to be able to see that from the analytical end and the implementation to the cure. They've been able to see much progress, and we're actually using the quantification and in reference to training to staff and to be able to improve the regulatory process. Always, this goes together with the foundation Ayúdame a Vivir that has worked on this for so long on these topics. It's about having access to treatment that is also aligned to the global initiative. You think we would want to establish, you think that yes, it is important for us to be able to establish our support to re-escalating this model in all of the countries in the region. We need to reiterate our effort and our appreciation to St. Jude's Hospital for being a key actor to having these initiatives becoming a reality, not only for our region, but for everyone. Catalan gave an example of tools that were used in NCC Picaya. This allows us to be able to see how we have these key efforts to be able to approach what we need. Just to finish by thanking each and every one of you that are here today. We know that we've extended this along and you're still with us here today. Every one of us here is a part of this initiative between the people that are supplying the medication until in reference to being able to see this part and having everyone becoming a part, an essential part of the management of cancer to any part of the region so that women and men, also mostly children, can have an access that is considered to be suitable for this end. Thank you very much, Dr. Massa, for your greetings and for the closing words. Apologies, there was a crossing in the audio. Thank you very much, Mauricio. Thank you very much to everyone and for being in the webinar today. And thank you very much. Thank you for all the work that is being done. I will ask the panelists to please open their cameras so we can have a final photograph taken. And we will then continue in our day, always together.
Vamos a tomar una foto.
We are now going to take a picture at 1, 2, 3. I think we're missing Kat and Lizette.
A ver, hay oportunidad de peinarse todavía. Ahí está Lisette. A la de 3. 1, 2.
Okay, again, 1, 2, 3 for the photograph.
Bueno, muchísimas gracias. Feliz día, tarde a todos.
Very good. Thank you very much. You'll have a good morning.